This video will hopefully change the way that you do your UCAT SJT. If you are an aspiring medical or dental applicant sitting the UCAT this year, then this is the page you need to follow. I've been a UCAT tutor of almost 4 years. I've also scored in the top 6% when I sat the exam myself, so I'm hoping that you find these tips as useful as I did. Number 1, the golden book for this section has to be GMC's Good Medical Practice. That outlines the code of conduct that they expect their doctors, their dentists, their professionals to uphold. It covers a variety of domains such as teamwork, professionalism, and it's a pretty quick read. You want to make notes on that document and apply it to these SJT scenarios. Number 2, this always sounds funny when I say it, but I actually mean it. Don't pick what you would actually do in the situation. Pick what you think is the absolute best thing to do, with patient safety being number 1 priority. Most of the scenarios they give you, they will give some sort of risk in terms of patient safety. Anything to do with risking patients, that's going to be very important, top priority. That's something to bear in mind. Now, this next tip should help you out with your interviews and your personal statement writing as well, which I also help tutor for, but that is to really get comfortable with your 4 medical ethics. I can make another video actually explaining what these pillars are, but essentially they will be applied to these scenarios as well. The next tip I think lots of candidates overlook, and that is knowing your role. They will specify this in the scenario. There are some things doctors can do and medical students certainly can't, and it's really important that you stay within the limits of your competency. You don't want to try and attempt things that you are not qualified for, especially if they're going to put patients or other staff at risk. And lastly, as well as the medical ethical pillars I spoke about earlier, you want to get comfortable with consent and confidentiality, those ethical principles, because they tend to crop up a lot as well.